What is harm reduction? In the context of people who use drugs or people with substance use disorders, we might hear this term used a lot. I wanted to come to you here today to talk about what harm reduction actually is, what some of the principles are, and what some of the strategies look like. The Substance Abuse and Mental Health Services Administration tells us that harm reduction is an approach that emphasizes engaging directly with people who use drugs to prevent things like overdose, infectious disease transmission, to improve the physical, mental, and social well being of those who use drugs. We also want to offer low threshold options for accessing substance use disorder treatments and other healthcare services. For the principles of harm reduction, what it really comes down to is having the person who is using drugs at the center of their healthcare decisions. We should be treating these individuals like we would anybody else with any other medical condition with dignity and respect, and making sure that the individual is very involved in their treatment decisions and that at the end of the day, they are making the decisions that fit best with them. We also want to recognize the inequalities and injustices that exist within the substance use disorder realm and making sure that we hold space for that for the individuals and making sure that we are prepared to help them navigate those different obstacles. Some of the strategies that we use within harm reduction include naloxone kits. Naloxone is a medication that can reverse opioid overdose, and it is an intranasal medication. It's very easy to use, and anyone within New York State can carry naloxone kits. Fentanyl test strips are another really great option to help individuals test their substances, whether it's an opioid or not, to make sure that that substance does not contain fentanyl, or if it does and they do want to use that substance, that they use additional safe use methods in order to keep themselves safe and to reduce their harm. Next is a statewide resource called Never Use Alone Hotline. This is a really great option that has a live person on the end of the phone while a person is using a substance, so that if they do experience overdose or any other negative outcome, you have a live person there who's able to call and get medical services to you. Safe disposal is another great option. If you have a substance that is expired or is no longer needed, you can safely dispose of that substance in either a safe medication disposal bag or in medication return boxes or at community wide events, take back day events, in order to reduce the likelihood that that substance is going to be misused or it's going to be accidentally ingested or lead to an accidental overdose. Lastly, there's a really great team of people here in Putnam County that are called peer recovery advocates. These are individuals who usually have lived experience in recovery and who are able to meet that person wherever they're at and really help them walk along their journey, whatever that may look like for them. For more information on harm reduction and prevention activities here in Putnam County, please contact the Prevention Council of Putnam at 845-225-4646, or you can go to our website, preventioncouncilputnam.org.